client communities. Given that our workers today, as well as children and adults, are not only being forced to stay home with limited and sometimes almost no human interaction, I think we really need to consider how to promote connectivity in different ways than perhaps we have in the past. Social connectedness, we know, is critical for good mental health and well-being, and apps have a potential to reach people who would not otherwise seek out or use traditional face-to-face or even crisis line or text line support services. We also can think about, as social workers, using them in between sessions for crisis support, for mindfulness, for homework, and as we'll hear today, much more. In fact, just in the past couple weeks, we've already seen an uptick in requests for accessing mental health services through the workplace as employees and their family members are working more remotely and isolated. People are stressed. Employers are realizing their role in working to support health and well-being of their workforce is a strategy not only for the public good, but also related to overall productivity, morale, and work life. So the combination of telehealth and the integration of mental health apps into mental health counseling is not only relevant for this time, but may even have an opportunity to help save lives. With that, I'm happy to introduce our topic today and our speakers, who will lead us through an engaging presentation focused on how to identify and how to integrate mental health apps into our practice. They'll also discuss the limitations and challenges of using apps, identify ways for us to begin to vet apps, and discuss the cultural considerations of how these may or may not fit into practice with our different clients and communities. I look forward, even though I can't stay with you on the call today, to hearing your feedback about today's session. I hope all of you will share with me and the School of Social Work how you're using mental health apps during this time of response to COVID-19 and beyond. I wish you all to stay well and stay safe, and I thank you again for all that you're doing to support others. I'm going to take a minute now to introduce our speakers on this webinar, and then I'll turn it over to them for the rest of our time. I'd first like to take a minute to welcome Dr. Stephen Schueller. Dr. Schueller is an assistant professor at the University of California, Irvine, and an adjunct assistant professor of preventative medicine at Northwestern University Feinberg School of Medicine. In California, he's part of the Public Service Minority Cluster at San Francisco General Hospital and a member of the Internet World Health Research Center. His research focuses on increasing accessibility and availability of mental health resources through the use of technology. This includes developing, evaluating, and implementing web and mobile-based interventions, particularly in areas for depression treatment and prevention. He's well-funded and a fellow at the NIMH Implementation Research Institute at George Washington University at St. Louis, and he's received several awards, including the Rising Star Award from the Association of Psychological Science and the International Society for Research on Internet Interventions. Thank you, Dr. Schueller, for being here. I'd also like to introduce Martha Neary. Ms. Neary is the project manager of PsyberGuide, which was an organization I was introduced to through One Mind at Work with Patrick Kennedy's group with Kennedy Forum. And many of you have probably seen that work and advocacy going on with substance use and mental health treatment. And I was really impressed with PsyberGuide that you'll be introduced to today as a nonprofit organization that's really trying to examine and promote mental health apps in different service areas. Martha received her bachelor's degree in psychology from University College Dublin and her master's in atypical child development from Queen's University in Belfast. Prior to joining the PsyberGuide team where she currently works, Martha was the project manager of an NIMH-funded study exploring mental health, mood, and behavior in infants and toddlers. Before moving from Ireland to the United States, she worked as a research analyst with the Growing Up Ireland study, which studied over 20,000 children in Ireland. She's also worked on research looking at health utilization experiences for young people with ADHD and in a more practical capacity with preschool children with autism spectrum disorders and student support services. We're so excited to have both Martha and Stephen here with us to share their broad research and practical experience related to mental health apps. And with that, I'll turn it over to our speakers. Thank you.
Fantastic. Thank you so much, Jodi, for such a wonderful introduction. Give me just 1 second to switch to my screen share here. Folks were asking if they should be able to see our slides yet. The answer before was no, but hopefully folks can see the slides now. Is everyone able to see the slides? Martha, could you confirm that? Perfect. Okay.
Yep.
Well, thanks so much. So today, Martha and I are going to be speaking about using mental health apps in social work practice. And I think Jodi gave us a fantastic introduction and really talked about how this is a topic that people have been extremely interested in historically. We definitely get a lot of requests to talk to folks about what we learned through our CyberGuide project and what we've learned through our work. But I think that it's really is becoming a topic that over the past couple of weeks has become even more important as people think about the changes and challenges that are faced in terms of remote work, both for themselves as individuals working in trying to support the mental health of other people as we try to take our work remotely. And then also for those clients and the people that we work with and are trying to help, and so far as they are now working remotely or accessing a lot of services remotely. And so trying to think about how these tools kind of serve the dual purpose of enhancing the work that we can do remotely, as well as providing more services to reach people remotely. Oops. So just the introductions were fantastic. I would just like to, kind of additionally note that my training and background is as a clinical psychologist. So I'm a licensed clinical psychologist and have contributed a lot to the training of clinical psychologists. And I think that's an important note because one thing that often gets asked, and we'll talk a little bit more about this in the presentation, is what role do we see vis-a-vis these technologies to potentially replace the work that we do as mental health providers, as clinical psychologists and social workers. And I think that that's really a false dichotomy. And I really want to kind of start out by today by saying that there's no way that these tools are going to replace what we do. As Jodi mentioned in the introduction, human connection is critical to the work that we do. And that really a lot of the ways that we think about technologies is ways to enhance the work that's being done through the human connection. So trying to think about technologies as services and platforms that increase that connection. And I think, Martha, it's a little funny to put up pictures of ourselves as we're video casting here, but we figured it would be nice to have pictures with more fun backgrounds or appropriate backgrounds than all of us sitting in our houses. Martha, do you want to do a quick additional introduction or note about yourself?
Sure, yeah. Hi, everyone. I'm Martha, and as Jodi mentioned, I'm the project manager of CyberGuide. So we'll talk a little bit more about what exactly we do at CyberGuide, but I sort of oversee all of our day-to-day activities and really interested in finding ways that we can use technology and mental health apps to access to services, and in particular for served groups. So excited to be here with you all today, and looking forward to having a discussion. And just to note as well that we can, I know there's some questions coming in the chat about receiving the slides afterwards, and we'll be happy to follow up after the webinar to send those slides to you guys if you need them.
Yeah, we'll definitely make these slides available and can have a link that you can download them yourselves.
So like they should have had I sent an email out with the webinar link and the materials. So they should have them, but I can definitely send it to them again afterwards.
Awesome. Thank
Great,
you.
Thank you.
Sure, no problem.
So just to start with some of the objectives of what we want to try to accomplish today, we want to talk about some of the benefits and opportunities presented by mental health apps. We also want to acknowledge the limitations and challenges. Despite being ensconced in this field, we definitely do not see technology as a panacea. Technology is not going to solve all of the problems that we have, and I think it's important to be realistic around where some of the limitations and challenges here. We want to talk about some different strategies and resources for finding mental health apps, and definitely CyberGuide, which we run, is a resource, but we also want to talk about some of the skills and competencies that are related to that. to address issues of cultural considerations and evaluation of fit of mental health apps, one app is not going to fit the needs of all people. And that's also a challenge, especially with a lot of the clients that we serve, in terms of trying to have competency in multiple different apps. And so one of the things and one of our objectives here is really to kind of talk about different cultural considerations, so that as you think about the different cultures or individuals that you typically serve or work with, to think about the ways that that might interact with the different apps that you might consider using. And then to talk very practically around some strategies just for introducing apps to clients and integrating into practices. Now, we're not going to be able to cover all aspects of that in today's webinar, so we're trying to provide an introduction to help orient people to some of the ways to start using these tools. But definitely, I think that if you are very interested in using apps in your practice, to really think about this as an introduction and a window into understanding that opportunity. And we'll talk a little bit more about different resources to kind of further build mastery and competency in those skills, if that's something you're really interested in. So we want to actually start with just a pool here to understand a little bit more about what people are doing already. And so the question we have is, have you ever used a health app with a client? So I'm going to launch a poll here. So you guys should all have a poll showing up right now on your screen. You can click yes or no. There we go. I see the results coming in now. Wait a second longer to see if you folks are able to respond to the poll. It looks about 2/3 of folks have responded so far. Great. So I'll share the results here. So it looks like, if you guys can see now on your screen, about just over half of you have actually used a health app with your client. And so I'd love to see if you guys want to type into the chat just some of the reasons that you guys have used health apps with your clients so far. And so that's one question. Why have you used a health app with your client? And then the second question I'd ask, if you guys could respond to, is how has that health app sort of entered into that relationship with your client? Has it been something that they've introduced, or is it something that you have brought into the interactions with those clients? So something that you recommended for them? Martha, would you mind sort of synthesizing some of the things that are in the chat?
Mm-hmm. Sure. So it seems like a number of people have used relaxation techniques in these apps. To provide clients relaxation apps that they can use at home between sessions. One person, Vanessa, thanks for mentioning you used Haste to help with brief guided meditation and mindfulness. Some other people are saying mindfulness apps. So it seems like mindfulness apps seem to be a popular one to use. Virtual Hope Box as well is one that was mentioned here. And also then the other group of apps is apps that can help people monitor their symptoms. So things like sleep issues or tracking mood. So from what's coming through here seems to be kind of two main groups of things. One is the meditation kind of relaxation apps, and the other is apps that can help people track their symptoms or track their mood over time.
Great, awesome. So I think that aligns a lot with what we've seen in terms of our experience, in terms of what people are interested in. I'll also sort of note the responses we got in terms of the number of you who've used health apps before and have not. I think if you've used a health app before, that's great. And I'd love folks throughout the webinar here. We'd love this to be as interactive as possible in this format. And so definitely we're going to continue to use that chat window to have you guys talk a little bit about your experiences and share your experiences so that we can also sort of interact with those. And so if you've used a health app, we'd love to hear more throughout the webinar about what you've seen, what questions you still have. If you haven't used a health app, that's okay. As I said, we're going to talk a lot about some of the different considerations and hopefully educate you so that you can make informed decisions on whether this is something you do want to use with your clients, and if you do use those with your clients, how you make the decisions around those things. And I find that at least when we look at the research, many people report wanting to use apps with their clients. Kind of across studies, we typically see if you ask providers of different mental health services, usually about 90% of people say they would be interested in using a mental health app with their clients. And about 50% of people actually are. So that conforms a lot with what we're seeing, at least in terms of the use of those apps with this group here. So I want to provide sort of a broad overview in terms of what mental health apps can do. And this definitely does not check the box of every mental health app. You will definitely be able to find a mental health app that does something that is a little bit different from this. But these are some broad categories of mental health apps that we tend to find to be some of the sort of most common things that we see. And these are examples of different health apps. And I'll mention right now, and this is worth as a disclosure, we don't have any vested interest in a particular health app. We're not supported by any specific health app. We don't have any financial relationship with any specific health app. So these are not apps that we picked as, ones that we have working relationships with our financial investments. And these are just some examples we've seen of some of the commonly used apps with research behind them that kind of represent different categories of things that we've seen. So mental health apps, what do they do? I think a lot of the reasons why clients tend to like to use health apps and mental health apps as well is that these tools help them track or understand some aspects of their experiences. These could be very broad aspects of experiences, like tracking one's mood. And so the app that we show here is a mood tracking app called Dailyo that allows them to check in, how they're feeling. This is an example. The preset is on a 1 to 5 scale that goes from rad to awful. But they can also be more specific tracking tools, such as tracking symptoms of a specific mental health issue, depression, anxiety, schizophrenia, bipolar disorder, medications that are related to those mental health issues. So medications that they take for individuals with schizophrenia, for example, and tracking the side effects that go along with those. But tracking seems to be a very common reason why people want to use these tools. When we've looked at reports from individuals who use mental health apps, we usually see about 40 to 50% of people are saying that they are using these tools for some sort of tracking purpose. The next sort of category of apps that we see a lot are apps that represent empirically based, evidence-based treatments and modify those into digital formats. And so this is an example, is an app called Sanvello, which used to be called Pacifica, which translates cognitive behavioral therapy into an app so that people can use that cognitive behavioral therapy digitally. And there's a variety of different apps that are created to support a variety of different evidence-based practices. Some of the apps that have been developed that are really good in this regard are apps that are developed by the Veterans Administration and the Department of Defense through their Connected Health Group. And they've developed a suite of different applications that support different evidence-based practices. Cognitive processing therapy, prolonged exposure, mindfulness, acceptance and commitment therapy. And so if there's an evidence-based practice that you are using with the client and you think that there could be a way in which the client's use of that practice could be supported by an app, we really do recommend looking at those VA and DoD apps to see if there's an app that kind of aligns with the way you're delivering that practice. The next sort of set of apps we want to talk about or mention are chatbot apps. And so these are apps that allow client interaction in sort of naturalistic types of language. So it allows the client to type in and receive some form of support through that application. Definitely these apps are, these are not humans. These are not therapists or social workers on the other side. And so it can provide a little bit of support, maybe sort of gives an intro into what some of these processes might be like, but again, are not a replacement for therapists or social workers themselves. I will say that clients tend to really like these types of apps. We've done a lot of research looking at analytics and engagement data, and we find that chatbot apps are some of the most consistently engaged in apps in the sort of mental health app ecosystem. That being said, I think that's based off of a small sample size. So there's not a ton of chatbot apps that are out there, but it is something that people seem interested in. And then lastly, and this is one that folks mentioned in the chat in terms of things that some of you have used, there's a big interest in mindfulness or meditation apps. So apps that sort of support mindfulness practices. This is a screenshot from Headspace, which is a very commonly used tool and a very popular one. There's many other mindfulness apps as well. And I think that one of the things that we want to sort of encourage or kind of talk about here is that really finding, a mindfulness app that sort of meets the needs for the clients that you work with, something that feels culturally appropriate, something that is has a fee schedule that's appropriate. So there's many sort of free tools that are out there that support mindfulness, and one that aligns with the way that you are kind of using these apps in practice. So again, this isn't an exhaustive list, but I think this is a pretty good sort of set of things that probably describes about 80 to 90% of the mental health apps that are out there. So we talked about this a little bit in terms of your comments for the last, in the last question, people did talk about some specific apps that they used. Headspace, mindfulness apps. Someone mentioned Virtual Hope Box, which is an example of one of those apps developed by the VA and the Department of Defense. Would love if you guys would just take a little bit of opportunity, especially those 50% of people who've used mental health apps. If you used a mental health app before, can you put in the chat box, one or two apps that have been your favorite apps that you've used in practice? And I think that this is a good opportunity to crowdsource with the community of the people we have here to talk about, what are the things that you guys have found useful? So what are some useful tools that you found in terms of mental health apps?
So some apps that are coming through now are, Calm, which is another meditation app. Breathe, I believe that's a meditation app too. Breathe to relax. A lot of people seem to have used Calm. 5 or 6 people here saying Calm. Insight Timer, Relax M, Virtual Hope Box, Calm, Breathe.
Yeah, and so I think Calm is, again, another kind of popular common app. And so I think that for those of you who have not used apps before, one of the things that we would really encourage, and we'll talk a little bit more about this later in the webinar, is to download these apps and put them on your own phones and use them yourselves so that you have a good understanding of what that app does and if you like it and how you might be able to convey that app to a client if they're going to use it. And one of the things that we've found in some of our research is that the individuals, the providers who seem the best able to use apps in their practice are ones who've used those apps themselves. So that some personal experience with that app is really, really sort of useful to be able to know how it might fit in. And can also, I think, help you figure out if an app is going to be useful or not. I think that, again, we want to sort of talk about some of the barriers and limitations to these tools. And if we look at the analytic data, so that's the data coming out of these apps in terms of the engagement, many people will download an app and not use it again. We've all probably experienced this with apps, non-health apps that we've downloaded on our phone. Something seems cool in the App Store. It might be free or fairly cheap. You put it on your phone, you open it up, you play around with it a little bit, and then you never go back to it. And so because of that, I think that if you go to an app yourself and you see that it's not engaging or doesn't reinforce some of the things that you're trying to work on in clients, that's probably as deep as a client's going to go into it. And so even a brief look at these apps can actually give you a lot of information about what the typical client's going to experience here. And then we'll also give you guys some understanding about ways to support better long-term use with your clients, if that's what you're aiming to accomplish.
Some other apps that were mentioned there, Stephen, were Talkspace and Ginger.io, which I think are two interesting ones as well. And someone had a question around what are the cost of these apps. So I think it's good to note that there are a lot of free options out there. So many of the apps have a free version and a paid version, but we'll talk more about that when we get to, finding apps and selecting them and making sure they're a good fit for your client.
Yeah, I think that typically of the apps that are paid that we look at, if the apps do not have a person behind it, which we'll talk a little bit more about what I mean about that in a second, the rates for the apps I think are usually between, like if it's a one-time download, maybe $5 to $10, or if there's a monthly subscription fee, those fees are usually between, I would say, $5 to $10 a month, which can again be prohibitive for some clients, and so I think that's something to consider. If we're looking for free apps, I think one of the places I often point people to are those VA DoD apps, because all of those apps developed by the VA and the DoD are free apps that do not collect any data from the individual. So I think that those are good apps from a cost perspective and good apps from a privacy and security perspective as well. And VA and DoD apps are also ADA compliant, and so they have a lot of accessibility thought put into it that's not present in some of these other applications. So I also want to talk a little bit about what mental health apps do not do. And so again, we really want to reinforce the point that mental health apps are not a replacement for traditional services, traditional social work services. We're not trying to suggest that people are not, do not need to seek traditional services because mental health apps exist. I think that one of the sort of big points that we try to make is that in some instances, for some people, when the case is not, traditional services versus an app, it might be nothing versus an app. An app might be a good window or starting point for people to get familiar with some of these techniques that we might teach through therapy processes or social work processes. But hopefully then that we're going to be able to get people into traditional services later if they need it. I think another thing to note is that a lot of mental health apps do not provide good information around privacy policies. So we did a review through our PsyberGuide website of about 120 different apps focused on depression, and we found half of those apps didn't even talk about privacy and security. So they didn't have a privacy policy whatsoever. And so again, I think that's one reason why it's useful for us to pilot or use these apps to, even if you do a cursory look to see, does it have a privacy policy, that rules out about, half of the apps, at least in the context of depression that we found. So I think that's another important thing to note is that there's a lot of apps that are not protecting your data or not practicing good privacy and security policies. And this is something that we do at PsyberGuide, which Martha will talk more about in a second, is do some assessment around that. But it's definitely an important point of assessment for us as we think about using mental health apps in our practice. And then I think another thing that worth noting about what mental health apps don't do is that a lot of mental health apps may not provide the evidence-based strategies that they suggest they do. So a review of cognitive behavioral therapy apps, or at least apps that claimed to be cognitive behavioral therapy, found that many of those apps did not have the effective elements of cognitive behavioral therapy. So again, one of the reasons we suggest piloting the apps or using the apps yourself is that it helps you understand not just what the app says it does or can do, but what components are actually included in that app, and do those components align with the different practices that you want to do. So when I think about mental health apps, I often think about their relation to human services or provider services along a continuum that includes these sort of three broad buckets. And so one of those buckets is what we refer to as standalone apps. And so these are fully automated self-guided apps that a person downloads and uses by themselves with no connection for a professional. And so that might be, could be useful if there is an app that is focusing on a topic area that you don't have expertise in, but are trying to support a client in. So for example, if you do cognitive behavioral therapy, but you're not well trained in cognitive behavioral therapy for insomnia, and you have a client with a sleep difficulty, it might be useful to recommend a CBTI or CBTI for a CBT for insomnia app to that client to provide those services, especially if you're in a place where it's hard to refer. There's not a CBTI expert in your community, or if the client doesn't have the resources to be able to seek one of those. So I think that standalone apps are standalone insofar as the client uses it by themselves, but it still might be connected in some ways to the services that you're providing. There are apps that are provided along with a professional coach or therapist, and we refer to these as guided apps. These are apps in which there is a provider of some form that is employed by the company that delivers that app. And so by signing up for that app, you receive some services along with that sign up. One of the apps that functions in that way is an app that one of you guys mentioned in the chat is Ginger. So Ginger is an app that provides telehealth services through the application itself. These apps are usually more expensive because of the fact that they're providing some form of human support. They are sometimes purchased by employers to provide services to their employees. So in EAP type programs, there are programs that are starting to adopt these digital programs. But the thing to sort of consider with these guided apps is that there is a coach or a therapist or someone who's being offered along with that application. And then there's adjunctive apps, which are apps that are used in the context of traditional face-to-face therapy or services. And so an example of an app like that would be PE Coach or Prolonged Exposure Coach, which is one of those VA or DoD apps I mentioned, which helps support the delivery of prolonged exposure, which is an evidence-based treatment for post-traumatic stress disorder, by having some of the homeworks and psychoeducation materials and tracking in that application. And so instead of handing out paper worksheets or worksheets to the client itself to kind of support that, you can actually use that application to support the delivery of prolonged exposure therapy. I also want to just talk a little bit about the research. We really want to focus this presentation on practice, but I think for being confident in using these tools, it's important to know whether or not there's research that suggests that these things work. And I'll say that overall, there does seem to be robust research indicating the efficacy and effectiveness of mobile health apps for mental health purposes. So there's been over 100 randomized control studies at this point. And those studies have generally shown that self-directed apps are modestly effective. So that means an app used by a person themselves leads to some small benefit in the clinical outcomes that app is developed to address. Guided apps are much more effective, and in many studies have been shown to be as effective as standard treatments. And so if you're using an app that has a provider behind that application, that app can often be as effective as face-to-face therapies. And another thing to sort of note is that guidance does not necessarily have to come from mental health professionals. There's been some research to suggest that technical support or paraprofessionals providing services through those applications is as effective as individuals who are trained as social workers or clinical psychologists. I'll note that this evidence is effective across a range of different health conditions. Apps have been shown to be effective for depression, anxiety, stress, psychiatric distress, and quality of life. So sort of subclinical symptoms or other sort of general wellness symptoms. Apps have also been used for different serious mental health issues such as bipolar disorder and schizophrenia. and have been found to be effective as well, especially when those apps are tailored to the needs of the populations. So if I think what I typically tell people is that if we have a traditional treatment that works for it, there's an app version out there that likely works as well, that we're able to translate our face-to-face treatments or our effective evidence-based treatments into digital formats. And those treatments, especially when provided along with a provider, are often as effective as the traditional treatments that we have. Some of the benefits that we see, so these are some of the reasons why people like to use apps, both from a individual level and also from a sort of public health perspective or a system level, is that it provides some extension of care. So it helps move the therapy or the treatment from inside the therapy room or inside the setting where we're meeting with our clients to outside. It allows us to sort of extend the care 24/7 as needed. They can be cost effective. So some research suggests that apps can reduce the length of time that people are receiving services because it allows more consolidated work. They're potentially scalable so that we can provide more services to people in need. They can provide real-time, real-world intervention delivery, so helping translate the skills into the places and the times when people need it most. They often use what people already have and use every day. So people carry around their phones, and usually for most people, their phones are within an arm's reach away. Whenever I talk about this, this makes me think about actually a research study I was doing where I was trying to understand some of the ways that these tools were being integrated into clinical care. And I was interviewing a client about the way that they typically were doing face-to-face cognitive behavioral therapy. And I was asking about the worksheets they got from their therapist. And they said, yes, I've got all those worksheets. I keep them all safe. I was like, awesome, where are they? And they're like, they're in a shoebox. I take every worksheet, I take it home, I put it in a shoebox. And I was like, cool, where's that shoebox? And they're like, yeah, I have no idea. Whereas most people can tell you at any point where their phone is. So I think it's a good way to keep the work that we're doing consolidated in a place that clients can go back to it. They can be used discreetly and on the go. We've had clients tell us about using these tools on the bus, at work, during a family gathering. It's quite easy to kind of go back to your phone and go on it, and that's not seen often as socially unacceptable, especially if you're doing it for just a brief moment, as opposed to if you're using carrying a worksheet around, it might be a little bit harder to go to that worksheet and pull that out to get the support. They allow for more reliable instant data collection through real-time symptom tracking. So all of us have probably had the experience of walking out to a waiting room or going to meet with a client and having them fill out some information that we had asked them to fill out throughout the week. And so there's questions about how reliable that information is, about describing different aspects of their week, but with mobile tools like applications, we can actually ensure that people are using these tools throughout the week. And then also that, as I mentioned before, there's promising outcomes for these things. What are some of the challenges? There is a major access issue, and I think that that's becoming even more apparent right now in the midst of trying to move so many things digitally, is that there is still very much a digital divide. Not everyone has a smartphone, and if they do, the smartphone may not be capable of using the different applications that we want people to use. Another common concern we hear in terms of access issues is either people share a phone and don't want to put a tool on there maybe that suggests a mental health problem to someone else who might use that phone, or they don't have the memory or storage capacity to download a new application. And so I think it's really important to know what the client base you're working with, what the typical access looks like, and then also to ask about access in non-stigmatizing ways to make sure that people actually have access to the tools. I think another thing worth noting, and this is a good point to mention it, is that not all apps are available on both Apple iOS or Android, and no client is going to buy a different phone. They're not going to buy an Apple device because you want them to use an Apple-based meditation app. And so it's important to either have comparable apps that work on either Android or iOS, or to pick an app that is available on both platforms. a lot of providers just aren't familiar with using these tools. And I think that there's a lack of training, which is why webinars like this are really great. And you guys are above the curve because you're interested in participating in something like this. Technology changes rapidly. So an app I mentioned earlier, Sendbello, used to be called Pacifica. And if you weren't aware of that change, you might kind of lose track of it. And so both apps appear and they disappear, apps change and get updated. You might be very familiar with an app and they can go through a pretty considerable update that might change the user experience. And so it does require one to stay on top of these applications. As I mentioned earlier, engagement rates, especially when not provided with support, tend to be low. And I think that this is something that's similar to homework completion that we see in a lot of sort of treatment settings that we work in, is that if you give it to someone and forget about it, they're going to forget about it too. And so definitely asking about these tools, even if you're using it in a more standalone version, just kind of like checking in about how they're using it. Is it working? Are they running into any problems? Doing a check-in, I think, is really important to make sure that people continue to use it. As I mentioned, a lot of these apps have privacy concerns. There are some quality apps out there, but that's definitely not the norm. And so if you look at all the different apps, understanding privacy is important. And then, although I mentioned there are a lot of studies out there showing the effectiveness of these tools, there are a lot more tools than studies. And so a considerable amount of apps have very little evidence behind them. And so we often refer to this as like the high availability but low evidence-based problem, is that there's tons of tools available, more than we probably need in the marketplace. And so trying to figure out what the most useful tools are is an important challenge. So going off that point, we often kind of talk about the good, the bad, and the many of health apps. And so one estimate is that there's roughly 325,000 health apps out there. Of those apps, about 15 to 20,000 are focused on mental health, depending on how broadly you define mental health. Only a small amount of these apps have rigorous evidence demonstrating the efficacy. So maybe 100 apps out of those 15 to 20,000. So as I mentioned, having 100 apps is probably sufficient and great. None of us are going to use 100 different apps in our practice. We're not going to have a set of 100 different apps we recommend to clients. So that's probably enough. But finding those 100 apps among those 15 to 20,000 apps is a considerable challenge. And I think that's what we've heard from a lot of practitioners that keeps them away from using mental health apps, is they don't know how to go from the wide amount of things available to them to actually find something that is evidence-based and likely to be effective. So the vast majority of these apps don't have any efficacy data. And I think when that's the case, at best, some of these apps might be ineffective. And at worst, you might actually have apps that are damaging or have information in there that is inaccurate or potentially harmful to individuals who use it. So this really makes finding the right app a challenge. It's not impossible, but it's definitely a challenge that we have to address if you're using these tools in your practice. So as a question, I would just like to kind of go to you guys and kind of talk, hear a little bit about for those of you who've tried to, or even if you haven't used a health app in your practice and you've tried to find some, where have you gone to try to find these mental health apps, and what tools have you found useful and what tools have you found not useful?
And as those responses are coming in, I might just summarize some comments that came through earlier as well in the chat. So Jeffrey had noted that in his experience, some young people actually bring apps to him and bring their own suggestions, and I end up educating him, which is encouraging to see. And I think that really fits in again to using a medium that people are already familiar with and already using. And we know, especially for young people, they're using their phones almost constantly. So leveraging that to use their phones to provide some sort of mental health support, I think, is really important. Megan also noted that some of her clients are bilinguals, so not all of the apps meet their needs. And I think that's certainly a challenge and something we'll talk about more towards the end of this webinar when we get to cultural considerations. And a couple of other comments came in as well about kind of non-mental health technologies and apps, which can also be used for interactions with clients, and particularly now that's becoming even more relevant. So a couple of people mentioned that they're using Zoom with their clients to connect with them. And I think it's important to remember that, you know, their technology can be integrated in a number of different ways, and there's lots of very useful uses that are outside of specific mental health apps. Do you have any other thoughts there, Stephen, on those comments?
Yeah, I think the point about non-mental health apps is a great point. And I think when we've surveyed individuals about what mental health apps that they use, typically about 33% of people come back, about a third, and talk about something that is not a mental health app. I'm using Facebook, I'm using Instagram, I'm using Spotify. And you know, the first couple times we heard those comments, we thought, okay, we asked the question poorly. Let's reframe the question, but we continued to hear that. And so what really, as we've dug deeper into that, we heard people really talk about powerful examples in which, like, they're using Spotify to create a playlist that helps, like a mood boosting playlist for them, or that reminds them of some of the lessons they've learned in therapy sessions, or they are using Instagram and putting only positive things on their Instagram and curating that Instagram so it is a truly positive place for them. And so that's definitely something I think it's worth talking to clients about, is if there's a platform that they like and something that they use, there might be ways to sort of shift it for the purposes that you're trying to accomplish. And, you know, I think the best tool always is a tool that people are using. And I think if a client comes in and brings a tool, I think that it's important to, you know, I would treat this like anything else the client brings into a session or brings into their relationship, is you want to do some sort of understanding of what do they get out of that and how is that useful in supporting them. And if it does seem like it aligns with the services that you're providing, that you can talk about different ways in which that tool might be useful. But I do think it's useful to think about how you evaluate that tool, which is one reason why, and Martha's going to talk about this in a second, our CyberGuide project is one resource you can use to sort of understand that.
And then in terms of where people find mental health apps, a lot of people say they ask colleagues or other practitioners, which is great to hear and something we would recommend. Searching in the app stores, and a few people mentioned that they would do their own search and then download the app and use it themselves. So that's fantastic. And that's one of our strong recommendations, is to always sort of test drive these apps. Asking clients as well was mentioned, which I think that goes back as well to the comment around kind of young people bringing these apps, and often maybe your clients will be familiar with apps that they want to use. So that can be another great way to find some. And then more kind of looking at trusted sources like SAMHSA or the VA can also be places to find these apps.
Yeah, I think those are all great recommendations. And I think that one thing I would sort of amplify in terms of looking at the app stores, I think that's it's a great starting place. It's also a challenge. And I think that one thing that we've really found is that the reviews on the app stores tell a story, but usually not the whole story. And what we find is that low-rated apps are usually indications that those apps are bad, but high-rated apps are not always indications that those apps are good. So it's easy to screen out apps from the App Store. It's harder to screen in apps. Another thing that has been found in some research to be a good indicator of app quality is how recently was that app updated. And so usually when we're looking at tools, we want a tool that was updated at least in the last year, if not the last 6 months, because that really shows that the app is going to function well, it's staying up to date with sort of current practices, it's improving based on what it's hearing from people. And so really, two of the things that we really try to emphasize to tell people to look at the App Store is when was it updated last? And then if it's a low-rated app, to overlook that application. But those are all great suggestions and things worth considering. So I'm going to pass it over to Martha, and Martha's going to talk a little bit about the CyberGuide project specifically, which is a project that we run that can be one resource in this space.
Thanks, Stephen. Can I first check, can you hear me okay? I know there was a comment that my sound was a little distorted. Can you hear me, Stephen?
Yeah, I can hear you.
Yeah, I can hear you fine.
Okay.
It went in and out for a second, but I think right now it seems your connection is good.
Okay, thanks. So yeah, I'm going to talk a little bit about CyberGuide. So we are a nonprofit project. We're funded by One Mind, and we essentially our aim is to provide people guidelines to use mental health apps and technologies. And we really want to help people use technology to live mentally healthier lives. And we want to help people make the most informed decisions that they can. So our primary output is app reviews. So we review apps on 3 different metrics. And I guess before we get to the stage, we find the apps to review. So there's a number of different ways how we find apps for review. We do frequent searches on the app stores. Sorry, I'm going to try maybe without, I know there's a couple of comments coming in that my audio is still a bit distorted. Without my headphones and see if that's any better. So we do frequent app store searches. Nope, that's worse.
Oh, I thought it was better, but
I think it's less distorted. It's a little quieter, Martha. So you might need to get a little bit closer to your microphone in that regard.
yeah.
Thank you. So we do frequent app store searches. We search for things like depression and anxiety on the app stores to find relevant apps. We also stay on top of research that's coming out that reviews different mental health apps. We have a number of different partnerships with different groups as well. For example, the ADAA or Mental Health America, and often we will have be referred apps through them. So there's a number of different ways that we find mental health apps. And we review these on 3 different metrics. So the first metric is credibility. So this looks at, is there research behind the app? Stephen, would you mind moving to the next slide? Thank you. So is there direct evidence for the app? So we look and see if there are research papers for the app itself. Is there indirect evidence for the app? Has it been supported by experts in terms of its clinical development? Is it scientifically supported, and is it technically supported? So that's really a lot of what we look at in the credibility scale. And really what this is trying to get at is how likely is it that this app may work for a particular client? The next metric that we review on is user experience. So this is really looking at, is the app fun to use? Is it engaging to use? Does it function correctly? Is it easy to navigate? Does it look nice? And I think that this is an important rating scale for a lot of people. I know personally for myself, even if an app has a high probability of working or is from a credible source, if I open the app and it's glitchy or it doesn't work very well, I'm probably not going to continue using that long enough to reap the benefits. And we find that this is a pretty important metric for a lot of clients as well. One of the challenges in this space is that we don't always see don't always see a strong correlation between credibility and user experience. Some of the reasons for that may be that products that have a high amount of scientific support, so maybe have been developed in a more academic context, may not necessarily have the resources to devote to developing a strong user experience. So that can be a little bit of a challenge for people looking for evidence-based products to use in their practice. And then the third metric is transparency. So this relates to data privacy and security. So what we're looking at here is, are developers sufficiently transparent about what happens to data once a user enters it? So we review the privacy policies of the apps, and we have a number of different key pieces of information that we want to see developers address in their privacy policies. We should note here that we don't do a technical audit of those practices. We just look at, is the developer providing sufficient information to the user in their privacy policies? The
the reason we review on 3 different metrics is that unfortunately there's no sort of magic number for mental health apps. Different things are going to work for different people, and different things will be important for different people. So really it will kind of depend on your priorities as a professional and your client's interests as well. Could you go to the next slide, Stephen? Thank you. So when you go to PsyberGuide, which is cyberguide.org, we have an app guide that has reviewed almost 200 mental health apps. And you can find apps based on combinations of conditions or treatment types depending on what it is that you're looking for. So for example, you might be interested in searching for an app for stress and anxiety, or stress and anxiety and mindfulness. So that's a way to search through the app guide. You can then filter your results as well if you're looking for something more specific. So you might filter by platform. If you know your client uses an Android, for example, then it probably makes sense to filter out all the iOS apps. You can filter by audience. So if you're working, for example, with children, you might be interested in finding apps specifically for that age group, and you can filter by the audience. And you can also filter by cost. And we sort of touched on this briefly earlier, that the majority of apps that we review at least have a free component, but you can also filter based on the cost there as well. So this will give you kind of a way to start to navigate the app marketplace, and can act as a starting point for finding mental health apps. We should note that having a product on PsyberGuide isn't necessarily an endorsement of that product. So we review sort of the good, the bad, and the ugly, and we really just try to help people make, again, informed decisions about everything that's out there. But being listed on PsyberGuide doesn't necessarily mean that it's endorsed. You will have to do a little bit more kind of digging into that product and read through the review that we have and look at the different metrics that it's rated on to learn more. So as I mentioned, our primary output on the website is app reviews. But we do also create some more resources to help people who are interested in using technology to support their mental health. So some examples that are here would be what we refer to as sort of app toolkits, and these highlight certain apps in a particular and on a particular theme that might be helpful for people. So for example, we have a snapshot here, or toolkit here, for the LGBTQ+ community, and 2 apps that we have reviewed that may be helpful for the community. We also have a toolkit here particularly for students, so apps that we think might be particularly relevant for students. We actually, in the last week or so, have also been creating more resources around kind of a response to the current situation and COVID-19, so we have other toolkits that could potentially be helpful to help people manage the stress and anxiety associated with the current situation. So those are all on our resources page, and we also share them on our social media and share them frequently with our audiences too. So yeah, I guess in addition to PsyberGuide, there are also other resources that you can use to find apps. Many of you already mentioned that you would ask peers and colleagues for recommendations. You also mentioned that you would ask clients. So are there apps that they are currently using, or are there apps that they have heard of and are interested in? And often if the client notes that they are actually interested in a product, then that might be a really good one to try out, because they already have kind of a level of interest and may be more likely to engage with the app. Attend trainings exactly like this one, and then keep an eye on different social media and listservs. That's also where we find many of our apps for review is through almost sort of word of mouth, and there's a great community around social work and clinical practice and digital mental health online now, so that can be another great place to find apps for review.
Just to emphasize that too, I think that it might require you to go out and find some new, or try some new technologies that you haven't tried before. So for example, Twitter is a place where you might be able to find some of these resources. And as Martha mentioned, there's a great social work community using hashtags like hashtag SWTech, social work tech, And so you can kind of join the conversation, even if you don't want to tweet or be a Twitter user. It could be a good place to just kind of keep up on some of these discussions and have another sort of community of practice to understand these things. So we definitely have found that technology is a good place to gain information because, unsurprisingly, the people who are using technologies to communicate about these things are often a little bit more savvy about technology, so might be good resources to find out how to use these tools, or good places to pose a question if that's something you're interested in. So we've talked about this idea a little bit already, and we really just want to reinforce that when you download an app, really the first thing that we suggest you do is to test drive the app. Or if you go to PsyberGuide and you found an app that you think you'd like to use in your practice, test drive that app. Or if a client comes to you and says, hey, I'm using this fantastic new app, meditation, breather, super app, that you do a little bit of research about that app, either go to PsyberGuide, go to a community, post on a listserv, post in a discussion forum, to see if people have any recommendations or ideas about that app, and to download it yourself and to test drive it. And we sort of really emphasize that there's a couple different things that you want to look at when you're test driving this app. And a lot of our thinking here has been informed by the great work that the American Psychiatric Association has done through their task force focused on technology led by John Toros. And the APA framework for app evaluation that uses this pyramid model that thinks about sort of different levels of information that you want to gain. So that APA model is there in the bottom of the slide here, thinking about the background information, privacy and security, evidence base, ease of use, and then lastly, data integration. So some of the things we really emphasize then based off of that APA framework is to think about, is the app actually useful? What does it say it can do? What does the app promise it could promote? And how will you actually know if it works? What changes will you see in the client in terms of their behavior or improvements in the services that you're providing to them? Is the app easy to use? Is it customizable? So if you look at those tracking apps, can you actually customize the information it's collecting? Can you change the anchors? Can you add symptoms? Can you add information around your own medication? And we find that customizability is an important aspect of long-term use, that if someone's going to use this for a long time, they often need to be able to make it their own in a little bit. And we know that the services we provide are evolving and changing along with the client and their skills and their situations. And so having apps that are responsive to changes in clients are also useful. And a lot of these apps do not have very much customizability. So I think that's an important thing to note. And then lastly, can you share information? So can the app share information to you as a provider? And not all apps can do that, especially not all apps can do that securely. And so thinking about the different ways it allows you to share that information. Some of it might be, it requires the client to print out that information and bring it yourself. But being able to print out a graph to summarize the information, like a mood chart, is really useful as a way to kind of use that in session. Another thing to consider is it safe? Really, we recommend only downloading apps from trusted sources. And I think that looking for apps that are associated with universities or professional organizations is a good way to start, or from companies that are robust and practice good privacy practices. Another thing to do is to do some education on the client side. So to teach them, if they're going to be using an app for these purposes, to protect their phones, to put a password on their phone. If you have an app that has a login, that's great, and to use secure passwords there as well. I mean, always to check if it has a privacy policy. And as we mentioned, surprisingly, this is actually something that rules out a lot of applications pretty early on. So something to consider in terms of the safety side of these things. Other things to consider is aspects, as we mentioned earlier, about access barriers, such as cost. Is there a cost that's passed to the client in terms of using that app, and is that cost reasonable? If there is a cost and there are some free features, are the free features sufficient for the work that you guys are doing together? Are there internet and data requirements? So some apps require connectivity, which means that you need to be connected to the internet. And so if a client doesn't have a good data plan or doesn't have sufficient access to Wi-Fi, that's probably not going to work as well as an app that can be downloaded and sort of self-sufficient on the phone. We talked about the software requirements in terms of Android and iOS, and then also phone sharing if an individual shares their phone. Another thing to really consider is the literacy or the education level. So how much of the information on that app is text-based versus video-based versus audio-based. It may not be a good app to use with your clients if it requires a lot of reading and a client doesn't have sufficient literacy level to read those applications. Or read the information in those applications. I'm also thinking about socioeconomic status. I'll talk about this in culture and race and ethnicity. I think something that we've heard from a lot of clients when they use these apps is that they want apps that feel like it represents them. And I think that different ways that apps can represent people is through the images they use, the examples they use, the language they use. And so if an app does not represent a person of color or does not responsive using examples that they go through in their daily life, that's not going to feel like an app that they don't see themselves in that application. And so I think that's another sort of lens to think about when you pilot these products or use these products is what aspects, how do they see themselves in these apps? And is there tailoring of the apps that are specifically designed for sort of different cultures? And definitely on CyberGuide, we have reviewed some products that are developed by specific communities to be responsive to that community. Meditation apps developed by African Americans to really sort of fit aspects of Black culture. Apps that are designed by individuals who are Latinx to be able to support Latinas and Latinos in their mental health. And so I think that, again, there's not a lot of these products, and I do think that's still a challenge, but there are some out there. And I think especially if you work predominantly with a certain cultural group, it's something to really consider. I think another thing, especially if you're working with young clients, to understand sort of family or school rules around phone usage. You definitely don't want to encourage using a phone in an app if they don't have the ability to use it in their sort of daily life. And also the client or the patient's familiarity, interest, and comfort level with using a technology. So if you're going to introduce an app to them, understanding a little bit about how much they use their phone, how comfortable are they using their phone. And there definitely is some great work that's been focused on improving digital literacy for individuals to support the use of these tools. Again, some of this work coming out of the great work that John Toros has been doing at Brigham Women's, and they have a training manual called Doors Manual that's available on their website. So there are some resources out there to address these things, but these are different considerations that are important to keep in mind. So this is just enumerating some of those points I made. You know, will that client really see themselves in that app? Really looking at the graphics and the examples, like reading that language. Color choice is also something that clients often talk about, and color choice sometimes varies across different cultures. You know, green and red mean different things in sort of traditional American culture as than in some other cultures. So I think that you just have to be understanding of the fact that these things can go much deeper than things that we often think about in providing services, and that we're very used to kind of talking about things in culturally appropriate ways. But when you're using an app, you have to think about kind of the look and the feel that feels culturally appropriate. Is the language inclusive and easy to follow? Is it written at a level that would make sense for the clients that you're working with? Another thing to consider, especially if we're thinking about trauma-informed care, because we know a lot of the individuals we work with have experienced different traumas. Are there different examples or exercises that can inadvertently activate triggers to a traumatic response? And so that might push us to certain apps that are developed with a trauma-informed focus, or apps like the VA DoD apps that are developed by individuals who have an understanding of how trauma impacts the behaviors and the emotions of the clients we work with. But again, another thing to sort of pay attention to when we think about the integration to care is how these tools might lead to certain triggers that might impact our clients. I think another thing to understand is that we as providers, if we're using technologies, have to reflect on our own biases. As many other places, as we do sort of clinical work, as we're working with clients, we have to understand what of ourselves are we bringing into that relationship. And so understanding your own relationship with technology. Are you a technology enthusiast? Or are you a technology skeptic? And making sure that you are not bringing too much of your own biases into using or not using a tool. You know, if you are an enthusiast, the degree to which you try to sell the client on using a tool is something you have to consider. If you're a skeptic, if a client brings a tool into your practice, having an open mind that a tool might be a useful way to work with them. Do you see technology as positive or frustrating? Do you tend to embrace or reject new technologies? And did you grow up with technologies? And definitely, you know, for all of us, we grew up with different degrees of technology. Even me being someone who works deeply in this area, when I work with youth and talk about different social medias and TikTok and Instagram and whatever new platform that they're using nowadays, it's a place where I need a lot of education from my clients or the folks that I work with in different research projects. And so really knowing where your limitations are and what you need to learn to be able to use this new medium effectively. So want to pause it here for some questions or some reflection for a little bit. Are there other things that you guys have seen in your own practice that have come into that you've thought that you want to consider when selecting a mental health app, or other things that have been barriers to you to selecting that you feel like it would be worthwhile for us to reflect on and talk about here for a second?
Sorry, one comment is age concerns. So should young kids be using apps or using telehealth services? And also another comment is that this person had one client who thought that they were tired of working with her and therefore suggesting an app instead.
Yeah, so I think that those are two great points, and to talk about those a little bit, let's just first go with age. And it was interesting when you said that question, Martha, and you said age concerns. I thought we were going to be talking about the older group, and to talk about the younger group is interesting. So a lot of kids are already going to technology for mental health purposes or for health purposes. So there was a large-scale study that found among folks aged 14 to 22, about 2/3 of them have downloaded a health app, and that the primary reasons they were downloading health apps were stress, anxiety, depression. Fitness was also in there, but 3 of the 4 top reasons were mental health concerns, and that having mental health concerns actually led to people more likely to download a mental health app or download an app. So that individuals with increased rates of depression, anxiety were more likely to have used a health app, usually about 3/4 of those individuals. So kids are already going to these places. So I think it is a really great place to engage them. I think that definitely there is some concern out there in the media, I think, hypes this around screen time and the relation, or social media and the relation to mental health. And I'll just say that broadly, that the research is not suggesting that there's a causal relationship between these things, especially if used in ways to sort of promote connection and to really promote ways to sort of relate to other people. I think another thing, especially with kids, that we've heard is that these tools can be very normalizing sometimes, and that if there is an app that kind of explains this and makes it feel like other people are experiencing this too, if someone develops something to address this. And so thinking about the right way to sort of frame the technology use for the kids is important. And also comment on the upper end of the age range too, because that's a question we often get, is that I definitely think there's some increased barriers sometimes with older clients around using technologies. They might have lower levels of technology literacy. Again, I think this is something that needs to be addressed client by client, because that's a stereotype, and there definitely are some very you know, there's older clients who are able to use technologies. My 80-year-old Nana is an amazing technology user, and she often teaches me new things about technology. So, you know, understand who your client is. But what we found for, if you have an older client who is not comfortable with technology, often if you can do a little bit of that technology training, technology literacy, if they're interested, they are sometimes some of the best users and most interested. And sometimes they actually find it a really useful skill to learn some technology and to practice that skill. I think one of the concern about shifting away or saying like, I don't want to work with you, here's an app or here's a technology. I think really one of the things that's worth talking about, and we'll talk about this in a second as we close up here, is thinking about how to integrate the tool into the treatment you're doing and to really frame it to the client that this is not a replacement, this is an enhancer. This is, and explaining to them how this tool fits into the services you're providing. And if it's, I don't have expertise in this area, but this app can help support that, and this is the expertise I have, and this is how it comes together. But really helping sort of normalize and understand how you see the treatment coming together and the integration of these things. But yeah, really great questions. So I want to talk just briefly, I know we're getting to the end of our time here, about some of the aspects of clinical integration and what we see as the core competencies. And so this actually draws from some of the work that the Connected Health Group at the Department of Defense has done, led specifically by Dr. Christy Armstrong, around, who's done a ton of training of DoD and VA clinicians around integrating mobile health into their practices. And they really talk about sort of 5 key steps and competencies. There's workflow, which is trying to think about how the work that you're doing might be impacted through the use of technology. There's the introduction. So how do you actually sort of frame the use of this tool for a client? There's the prescription, and here in prescription, we don't mean in sort of a traditional, like, here's a medication, but how do you give the information to the client around what tool should they be using, what is the dosing, what are the side effects? So trying to take that sort of prescription paradigm and apply it here. How do you actually review the data collected with the app with the patient? How do you reinforce the use of that in the sessions that you have? And as I mentioned earlier, using these tools, much like we would homework, checking in is really important. And then lastly, documenting. How do you document those in patients' records? Now, we're not going to be able to go through all these competencies today. As we mentioned, we're really trying to do an introduction here. But there is a lot of material out there that the DoD has released, including a clinical mobile health practice guide that talks about these steps if you're interested. So just wanted to highlight these as important competencies and then to focus in on a few of these competencies here. So we want to talk about introduction because this is something that we see people struggle with often, which is how do you bring an app into work with a client? So we really see as a first step for introduction is to assess the individual's use and understanding of smartphone apps. Do they have a phone? What do they do with their phone? How often do they use it? Have they ever used a health app before? Because that might mean that they are already sort of on the same page of using an app for their health purposes. And as I mentioned, for some clients, in some groups, there often are a lot of people who've used health apps already. It's as high as about 2/3 in young folks and about 50% in older individuals. So usually between 50% to 2/3 of people have already used a health app, which is important information for you to know. You want to describe the purpose of the application. Who's it intended for? How does it fit them? What is the app intended to do? What are the targets? What is it meant to accomplish? What are the goals? And what are the activities? How are you supposed to use it and what will it do? You want to describe the key features. So does it have lessons, psychoeducational information? Does it provide some symptom tracking? Is it used to support homework completion? And what is that homework? And what's the way that an individual can go back and review that information? And then lastly, you want to set expectations. So how frequently should they use it? How long they should be using it? What's the timing of the use? You know, this is a tool that you use for 5 minutes every day. You put in your mood. This is a tool used for 30 minutes once a week where you sit down with the app for 30 minutes and go through all this content. This is a tool that you can use for 10 minutes about 3 times a week. Like really thinking about those aspects, again, just like you would dose anything else. And then lastly, how will you be using that app in the session? Will you just be checking in and saying like, how has that been going with that app? Or are you actually going to be using that data in the sessions that you're working with them in a more integrated way? And I think depending on the app, we don't have sort of clear recommendations in that if you necessarily need to be bringing in data from that app, but we do think that the strong recommendation in terms of best practices is that that app should be checked out for some reasons. In terms of data review, I think one thing, as we mentioned, is important is that most apps do not provide data to clinicians, and this is often a safety, privacy sort of issue, is that sometimes it's complicated to share that information. I think one thing to sort of note is that it's often challenging or could be challenging to use a small phone to trade off with a patient and a clinician. Your client may not be comfortable handing over their phone to you. And data review may not always be intuitive. I think another thing worth note here is that some people see the data that comes from applications as sort of more objective or more accurate. And we really sort of encourage you to think about this as sort of another piece of information, and that you often have to triangulate or understand that data for the client. So if an app is telling you, for example, that a client had a really bad day and they say, no, that day was fine, I don't think it's worthwhile, and I wouldn't recommend to kind of call out the patient and say, but your app data says this. But really trying to understand maybe why they see their days differently from their app reported. Or if you have an app that's collecting sort of sleep data, similarly, it's not useful, I think, to challenge the client with the information coming from the app. So we really don't see this as more objective. We just see it as a different source of information that feeds the work that you're doing. Some of the goals that we often encourage people to do in terms of reviewing data, because I know data can be overwhelming, especially if you have a lot of data coming in from these applications, is to look for patterns and trends. So what seems to be the commonalities over time, to notice outliers or extreme values. So where do people report very high values or very low values, and to talk to clients about why those values might be the case. So in mood tracking, what are their best days and what are their worst days? Or in tracking of side effects of medications, what were the days where they had the most side effects that are going on? And then lastly, to think about sort of understanding in action. So how do you actually take that data and do something meaningful with it? So data is useful insofar as it changes what you guys do in session and what the client is doing with the work that you're doing. I think just a couple points around how to get the most out of apps. As we mentioned before, we really see apps as sort of supporting the use that we're doing as providers. And so trying to make sure that a provider is kept in the loop somehow, thinking about these tools as technology-enabled services rather than products. Another thing we note with a lot of people is trying to make sure that the use of that app is regular and reliable. So making a habit out of the use, using it as intended. So one reason it's useful to be clear about those expectations is that we want to follow up and know that they're using it in terms of the expected frequency and duration. And then also knowing that different features of the app and how they work. We'll actually we've got a couple questions here, but I'm going to skip these in the interest of time and just mention that we've been putting out some resources from PsyberGuide about apps in the midst of COVID-19. So I think a lot of tools are coming up with either COVID-19 specific coping sections or are free apps in relation to COVID-19. So here's a couple different tools that have either free content, so premium versions that are now available for free, or special content, special sections where they are collecting resources for COVID-19. And again, these slides were shared with you or will be shared with you. We also have these resources available through our PsyberGuide Medium page. So if you guys are interested, but we felt like it would not be, we couldn't give this talk on today without sort of emphasizing these a little bit. And then, as we mentioned, we'll continue to share some COVID-19 resources through PsyberGuide. And with that, that's the end of our presentation. We have just a couple minutes here for questions. I know we've been pausing all the way along, but if anyone has any last questions here. We have a couple minutes to follow up on here, so happy to take any additional questions.
I've been responding to some of the questions that have come through, but one that came through a few minutes ago was around managing parents' expectations and making sure that there is access to technology when needed when you're working with adolescents. Do you have any comments on that, Stephen?
Yeah, I think that, you know, as with any work with adolescents, getting parent buy-in and being on the same page with parents is really important. And I think that parents also need to be informed about what sort of the expected use of that tool is and how often they should be using it to make sure that they understand what the ask is of that child. So if it's a tool that they want to be using on a daily basis for a little bit, that they can be able to use that, you know, that they have the space and the time to do that. But I think, again, a lot of what we really see there is just expectation setting. I saw a question here about someone working at a college and you know, not being able to provide clinical counseling, but providing health and wellness resources. And is it recommended to refer students to some of these apps without being able to follow up? So what I'd state there again is that for some of these tools, there is evidence that if used on their own, they can lead to some small benefits. And that if the case is that there aren't resources that are provided to a person, it might be better than not, like an app might be better than nothing. I think the challenge, there's two challenges I see. One is trying to figure out which apps you recommend to people. And it's actually something we've been working with our counseling office at UC Irvine to be able to help them provide some resources or suggestions. And then another sort of thing would be, is that there's some way to follow up with them that doesn't require a lot of resources. So maybe 2 weeks afterwards to send them a text message and say like, hey, did you download that app we recommended? Is it working for you? Do you have any questions? Could we recommend a different app for you? Because as we mentioned, you know, there's not gonna be one app that works for everybody. And sometimes some of the check-in needs to be sort of switching of like, okay, we recommended a cognitive behavioral therapy app. It doesn't seem to be working for you. Maybe we could recommend this other cognitive behavioral therapy app that would be a better fit. So I think that's one thing. Again, in our sort of view, oftentimes, especially if these tools are validated, have demonstrated effectiveness, it might be better than nothing, but there might be some low resource ways to still check in with people, even if there's not a social worker to work one-on-one with them in that setting. So I think we're at the end of our time. I want to say just thank you so much for everyone attending today. Thank you for being fantastic in terms of interacting through the chat. It was really great to see your questions, and hopefully those of you in attendance gained something from seeing the comments and the questions and the ideas from other people here. I think, you know, we really see this as a great example of a community of practice. We think these webinars are really useful. And we're always happy to provide support or suggestions to individuals. So feel free to reach out to us via CyberGuide. Our emails are also easy to find, and we'll make sure that people get the information that was requested in terms of the slides and some of the other resources that we talked about in the webinar. So thanks so much, everyone, and enjoy the rest of your day.
Bye, everyone.